Welcome to Duke Spine Institute. We're live streaming spine surgery. Our patient is a Korean War veteran. He's been in the United States military for many years. He served overseas and flew missions during the war. He served our country, but he also injured his neck. He has neck pain. It's on the left side of his neck, kind of involving the whole left side of the neck, and it's worse when he rotates his head and looks over his left shoulder. We diagnosed him with facet joint pain due to arthritis in the joints, and he is here today for the Duke plasma rhizotomy, left side. That's what we're doing right now. We're going to go in and destroy the pain nerves that are responsible for the pain he experiences every day with his neck. He hasn't been able to golf. He hasn't been able to do anything. So we've made a 4-millimeter incision, and we're now going in to destroy those pain nerves. We're going to use our probe to do that. We're going to go down and target the source of this pain, which is the somatic afferent nerves called the medial branch of the dorsal ramus. And you can see at the tip of the probe right there, that is where the first nerve comes around the corner. Yeah, he's responding too much. And we're going to give him a little bit more sedation. Any questions?
At this moment, no current questions.
Let's show the audience how facet joints in the neck cause so much pain.
Of course.
All right, welcome back. You can see from our video how people get so much pain in their neck from the facets. The facets get injured. Patients get arthritis involving those joints. That arthritis is very painful, especially with movement of the joint. And our procedure destroys the pain nerves. That's the whole point of the procedure. Destroy pain nerves, causing pain to be transmitted from the painful joints up to the brain. This concept of rhizotomy has been around for a long time. Just how we do rhizotomies over the years has evolved. Duke Spine Institute has pioneered the most advanced rhizotomy treatment in the world, the most successful, and the most permanent. This is a Duke plasma rhizotomy. And what makes it different is we actually go in and destroy the pain nerves. With an RFA procedure, the pain management doctor does not destroy the pain nerves. They try to destroy the pain nerves, but putting a little skinny probe in there and heating it up to 80 degrees Celsius for 90 seconds doesn't work. It will not destroy the pain nerves. Shot? Oh yeah, it's perfect. This procedure 100% destroys the pain nerves. So he will not have that same pain. He will have a different pain. The different pain will be pain from my surgery, pain that I give him. Almost done. Have a few more joints to do, and we'll be done. Any questions?
At this moment, no current questions.
Let's show our audience how this Duke plasma rhizotomy works to get rid of facet pain in the neck.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And good morning, I'm Dr. Duke Majan at the Duke Spine Institute. I'm here with my patient who traveled to Duke Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then?
Yeah.
Why did you decide to come to Duke Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
Infusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Duke laser disc repair and the Duke plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option, because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.